So this is a video for PreMeds specifically about scribing. So what is a medical scribe? A medical scribe is someone that follows the doctor around and takes down the patient's information. For example, why are they coming in? What symptoms are they having? How long has it been going on? And basically just helps them document all that in the patient's chart. Usually it's, you've probably seen them in the ER, just the teenagers walking around with laptops near the doctor and just taking down information. So in my experience, this has been one of the best experiences I did as a pre-med, just because for example, shadowing is fantastic. I've had great shadowing experiences. However, this is on another level because you're part of the process. You're in an introductory position for medicine because you help be part of the process, and it's pretty cool actually because you're basically the doctor's sidekick. And I think it was really helpful for me personally just to clear away all my misconceptions about medicine. I thought I knew medicine pretty well because I had shadowed a lot of doctors. I had a lot of exposure to it, but when you're working actually in medicine and you sit with the doctor and you take down the chart and understand everything that goes on, you just see medicine in a whole new light. Because I know as a pre-med or maybe as a high schooler coming into college, going on the pre-med track, medicine might be this idolized vision in your mind. It might be so romanticized that you spend so much time with the patient and just help them and everything. But in reality, you spend very little time with the patient. For example, in the ER, doctors spend maybe less than like 5 minutes with a patient just because of how fast the process is. So most of the time is just talking to other doctors for consults about a patient, or taking care of documentation, or ordering, or reviewing labs and reviewing x-rays. So it was very eye-opening for me. So I think it's a fantastic experience for anyone considering going into medicine. So that's why I definitely recommend becoming a scribe. And another thing is something that was really important during the interview cycle while I was trying to get into med school is that you can talk about the mortality of part of medicine. As a scribe in the ER, I did witness people die and just in these emergency situations, and I've also seen people live. Someone that was actually dead, after like 2 hours of work, they brought them back, and it was amazing actually, because that's what medicine is about. I was so entranced by that moment because you genuinely saw someone that had no heartbeat, and then they brought them back, and then they survived, which I thought was incredible. And then the other thing is, yeah, you can see people die in the ER, and then you have to go straight back to work. Just like the doctor that took care of them announces their death, and then they just go straight back to work. And so I think it's a very important part that you have to get accustomed to. I'm not saying every specialty will be like that, but it's definitely a part of medicine, the mortality issue. And it's something that you have to be psychologically ready for. And I think that's very important, and something that's not really talked about, because we only think about helping people, but we don't see the other side. So those are just a few points of why I think scribing is a great option for anyone considering going on the pre-med track, just because you get fantastic experience, just because you're part of the process. Even if you shadowed for 8 hours, I don't feel like you would get the same amount of exposure, just because since you're part of it, you understand it more, that you're taking consults. If you just sat in a corner watching them, I think it would be you'd understand it, and you get to see it, and you definitely be better. But this is not only that, but you're in the process. So it definitely brings it more home for you. And so I think I would really recommend scribing. And also you get paid, which is not much, by the way. Scribing usually doesn't pay that much if you go with a company. But it's really not for the money. It's just for that experience. And these are some actual tips if you do decide to become a scribe for the actual job. So the first few days will be difficult, just like any new job. Everything's new, and this is something I really want to tell you, just because when I first started, the first 3 days were really, really difficult for me, because the system was just so complex for me. It was very difficult to grasp all the information the patient and the doctor threw at you. Just so much new information, and I really found it super difficult, and like I honestly didn't know if I thought to myself, if I can't handle this, how am I going to handle going into medicine? And so luckily after 3 days I realized it was actually pretty streamlined, and your brain really just picks it up naturally and gets better, just like anything in life. Just the practice helps build that foundation, and then from there it becomes a lot easier over time. But some specific tips to help you when you're in that process, so that you can help the process and help keep moving forward, is to study common names of drugs. Blood thinners are a common type, like Xarelto, Coumadin, just because when people hit their head, a common question that will be asked is, are they on blood thinners? Because blood thinners will increase the chance that they could have a serious head injury. And study of the abbreviations, that will also help you. Just be really familiar with medicine, because I know some people that think they are really familiar with it, but then when they start scribing, they really don't know a lot of the common stuff, the stuff we take for granted after a while. So just study as much as you can, and remember that if you ever doubt something, just write it down and then just Google it. I still do that, and even the doctors do that, because they don't know a lot of the drugs, and so you just have to Google it, and then you'll be okay. Because like I said, the doctors don't know the thousands of drugs that are out there, and so they just quickly Google it, and then you can get the correct spelling, and then just put in the chart. And something that that's overlooked is that doctors make mistakes, and I think this is really useful when you get into it. You see that they make mistakes, and then you can actually be part of the safety net that catches it. It might not be a life or death mistake, but I think it's still cool nonetheless, because you help part of the process to improve accuracy. So one of the easiest mistakes in medicine is just the left or right. For example, if someone has a laceration, a cut on their left arm, the doctor might tell you that it's the right arm, but you saw that it was the left, and so you can just gently remind them, and they'll usually confirm that it was the left. So stuff like that. Just make sure to say it in a kind way, not like try to be arrogant about it. And then this is a hard one, but if you are unsure, especially in the early days, you have to always ask, because even though these charts might not necessarily be life or death, they still do carry an importance. They still are a liability for the doctor, and if your chart is incredibly messed up, they could be sued over that, and so you could end up hurting the doctor. So definitely take this job seriously, and hold yourself accountable, right? Because sometimes the doctors genuinely hate doing documentation. I think you would too, right? Over time, you want to help people, but you're just buried by all this documentation. And some doctors just end up like not checking your charts because they trust you. And so it's up to you to actually make sure that you have high accuracy on these charts, and double check it for spelling mistakes, and just hold yourself accountable. So, yeah, so, what I was going to come to say is, if you do have a question, just ask. And I think this is an important life lesson for pre-meds, right? Because since you are considering medicine, and one day you'll be a doctor in training, there will be a lot of times you don't know the answer. And I think you have to learn how to ask for help. Because if you don't, that could end up costing someone's life. So definitely pretend this is like a safety net, and so pretend it's like a serious situation. And you will have to swallow your ego to ask the doctor to repeat something if they just said it too quickly. And so even though it hurts, I would say just do it anyways, and pretend it's like the patient, or pretend it's like someone you care about. You double check it, right? So just pretend like it's a really serious situation, and so it'll be good practice for you to actually practice that skill of asking for help, because this is a team effort overall. And that's also something I talked about during interviews, medical school interviews, by the way, just because this will help show you that medicine is no longer just a doctor working on his own. It's a team effort, and I think that's something you can really elaborate on and help out and show that you know so much more in your interviews. And I think if anything, out of all the experiences I had in my pre-med life, I would definitely consider this one among the top. Scribing definitely showed me the most of medicine, taught me a lot, just about common presentations of illnesses and common treatments. So overall, I would say that this has been a fantastic experience, and I would definitely recommend it to anyone that's thinking about going into medicine. So I hope that helped, and thanks for watching.